Hello, everyone, and welcome to another audio podcast. In this series, the Storm Logistics Case Review V2. This is another Storm Logistics production, and today I'm going to give a sort of an overview around the reflections on social media in healthcare, and it's in part and in keeping in part and in keeping with in regards to research that had taken place between 2017 to 2021. But before embarking and conducting sort of formal aspects of research, there is a part of this audio podcast that I am gonna relate to, or there is part of this audio podcast I am going to highlight some aspects relating to public involvement in the changing landscape. And basically, this was part of the Involve conference that took place in November 2014. And basically, in this audio podcast, the plan is to the plan will be to highlight a little bit around the public involvement in the changing landscape, in line and in remit with this Involve conference that took place in 2014, but also in relating to works that has now been put forward for peer review, and the works also have been where works had been presented as formal research in a conference known as the British Society of Lifestyle Medicine that took place in Wales in 2019. I am going to highlight a little bit of data and some aspects around that, and sort of highlight sort of some aspects in relating to sort of new models of healthcare, and some context in relating to laboratory medicine. Once again, this is the Shientist, and I'm going to provide this as part of the ZtormTronix case review v2. So to begin with, it was in 2014. The Involve conference. The Involve conference took place in I believe it was in Birmingham City, Birmingham in the United Kingdom in 2014. Now, one of the speakers amongst the conference remit was someone named Dr. Russell Hamilton, who was the director at the time, Director of Research and Development for the Department of Health. And basically, at this conference, he talked a little bit about the National Institute of Health Research, or NIHR, health research system. And within the context of the NIHR, at least by the understanding of Dr. Russell Hamilton, he did say that the NIHR consists of a faculty. There's faculty where there's investigators and senior investigators. There's trainees and there's associates, and then there's almost like a separate faculty in relating to research, specifically around research projects and programs, and then research projects and research programs in line with research schools. And then there's research information systems and research management systems, which fall under the remit of systems. And then there's within NIHR, there's also the infrastructure, which is linked with clinical research networks and clinical research facilities, centers, and units. And generally, all of those where you have the faculty, research systems, and infrastructure, they all link or have a link in part, in part with academic institutions, NHS trusts or National Health Service trusts, and also at the center of all of that, you have patients and the public. Now, Dr. Russell Hamilton then goes on to talk about what is what is or what was what is the NIHR and what does it do. Now, mainly, the NIHR is funded by the Department of Health, and the research arm is the NIHR is generally known to be, or termed, open quote close quote, the research arm for the NHS, or of the National Health Service, and it's basically the largest public sector funder of health research in the country, in the United Kingdom, and the most integrated clinical research system in the world. And finally, the NIHR supports it supports researchers working in world-class facilities, conducting leading-edge research focused on the needs of patients and the public. So in 2014, Dr. Russell Hamilton also highlights sort of perspective on what has the NIH and what has the NIHR done so far. And this was in 2014. Obviously now it's in 2022, but I thought I'd provide this in this overview. So Dr. Russell Hamilton says the NIHR, the National Institute of Health Research, massively increased the number of clinical trials in the National Health Service. So at that point there was 1,300 new studies through the National Institute of Health Research and Clinical Research Network. There's been more than double patient participation in research, over 0.6 million people this year, and that was 0.6 million people this year in 2014. And the NIHR has strengthened the research culture of the NHS. So 100% of the NHS trusts now are interactive in clinical research. The NIHR has driven faster translation of basic science discoveries into tangible benefits for patients and the economy, and also helped reverse the decline in numbers of clinical researchers, and also increase transparency, so whereby they're the world's first funder to publish comprehensive accounts of commissioned research in the NIHR Journals Library. And finally, the NIHR in 2014 had been highlighted that it's a world leader in public involvement, in line with this, Dr. Russell Hamilton had mentioned that I believe passionately that high quality research is essential to improving health and healthcare, and secondly, high quality patient involvement and public engagement is essential to high quality research. Dr. Russell Hamilton also highlights sort of a timeline between 1996 and 2001 in line with patients and research. So between 1996 and 2005, they asked the question, where have the NIHR, the National Institute of Health Research, been in the early days? So there was some discussion where Dr. Russell Hamilton highlighted this in 2014, and then in 1996, the Department of Health, for example, established a standing advisory group for consumers in the National Health Service research known which is now known, at least back in 2014, was known as Involve. And in 1999, Involve was coordinating a center. The Involve Coordinating Center had been established, and then in 2001, the Department of Health Research Governance Framework, Department of Health Research Governance Framework for Health and Social Care was in some part implemented. Now, there's a direct quotation here where Dr. Russell Hamilton has highlighted from a document that was published in 2005 by the Department of Health, and I'll read what it says. It says, relevant service users and carers or their representatives should be involved wherever possible in the design, the conduct, the analysis, and the reporting of research. And so, Dr. Russell Hamilton then also says that getting involved in related to patients and the public and research, getting involved in sharing experiences. In 2014, he highlights that nearly 100 people with a remit for public health, for public involvement across the National Institute on Health Research met in July 2014. Health Talk. So Health Talk is a online based website which relates different specialties and statistics around different specialties in context of health and disease, for patients and the public to get understanding around different topics. So Health Talk online talk to 37 people about their experience of being involved in research. And then in the works that Dr. Russell Hamilton was highlighting, there is a link to the Health Talk organization, and then he also says Dr. Russell Hamilton says the first Involve conference was held in 1998, and 100 people attended at that time. And in 2014, nearly 500 people attended that conference at Involve in 2014. In line with this, there was also some aspects relating to Generation R, which related young people improving research, and there was apparently context where Dr. Russell Hamilton highlighted the event was developed and led by young people and parents to showcase the role and achievements in working with researchers and industry. There were other presenters, and I was going to provide an overview of different presentations. Different presentations. One of the works I have mentioned, I believe I have mentioned in a previous audio podcast, where one of the colleagues. One of the colleagues that I had been collaborating with presented their research or their works around the use of social media for people with long-term conditions to facilitate learning in higher education, and it was a chronic kidney disease perspective. And the colleague was presenting a poster at the conference in relating to where they were highlighting the importance of where patients who had dialysis access, who had renal replacement access, where they would have a wristband around their wrist highlighting to health professionals that they should not and were not to cannulate that particular arm or part of their body, because primarily it would be used for dialysis or renal replacement therapy access. So a colleague was talking or highlighting some of the data that came out of the renal patient support group. Some comments, because the colleague did approach the renal patient support group, the RPSG, in relating to getting some initial comments based on the initiative that they set out before 2014. And so the poster was presented at the Involve conference in 2014 around that. Now, following on from that, I am going to now talk a little bit about some research that has taken place more recently. Again, this work has been presented at a conference that took place in Wales, the British Society of Lifestyle Medicine, or BSLM. Basically, this research was related to some poll-based data on asking a particular question. So in relating to reflections on social media, the works that I'm going to highlight relate to works that focus on the use of social media, and sort of my reflections in part in sort of being sort of a lead on sort of an academic lead in relating to this works, in line with the renal patient support group. So this works was around a need for healthcare scientists and educational support surrounding chronic kidney disease and laboratory investigations and tests. And it's basically a poster presentation that summarized the polls through poll data through the renal patient support group RPSG platform. So I'm going to provide an introduction and intro, and the introduction I'm going to provide falls under the focus of chronic kidney disease and new models of care. So patient access to information support to supplement understanding of laboratory and test parameter faces challenges owing to medical and scientific terminology. Such terminology is sort of everyday language for health professionals communicating with each other. So health professionals communicating with other health professionals is everyday language. However, for professionals who look to communicate with patients, the medical terminology can be overwhelming, and so such concerns can give rise to provision of advice, information, and education around several aspects of healthcare and disease. So now I'm going to talk a little bit about what is chronic kidney disease. Chronic kidney disease, or CKD, is an irreversible long-term condition where reduced renal function or kidney function is evident, and kidneys are unable and cannot filter blood as per normal physiology. And chronic kidney disease is a major public health concern because there is considerable overlap between chronic kidney disease and other health conditions, for example cardiovascular disease, and the risk of developing chronic kidney disease generally increases with age as people get older, and there is a higher risk of dying from something known as acute kidney injury than there is from myocardial infarction, or MIs, breast cancer, heart failure, and other conditions. And due to increasing prevalence, increasing prevalence and costs, creatinine remains the gold standard biomarker for renal function, and the estimated glomerular filtration rate, or eGFR, is a calculation that allows a general evaluation of creatinine in blood filtered over 24 hours through the kidneys. There's a table in here in this poster presentation which highlights CKD stages, CKD severity, against CKD classification. So generally, the table is classified into 5 different stages according to the level of kidney damage and the ability of the kidneys to filter blood. The glomerular filtration rate, or GFR, measures the amount of blood that passes through the tiny filters known as the nephrons in the kidneys every minute. And as the disease progresses, the GFR falls. The GFR, glomerular filtration rate, falls. Stage 3, or CKD stage 3, chronic kidney disease stage 3, is divided into 2 parts, stages 3A and 3B. But classification for these 2 subdivisions were not highlighted in this particular work, in this poster presentation. So a little bit about new models of care. So healthcare scientists who generally perform laboratory investigations can provide specific education and guidance surrounding laboratory trends and parameters, when to screen patients for specific disease states, and prompt reference for treatment and referral, and thus shift the cost of healthcare from the NHS, from the National Health Service. Now, the key there in the poster, in this work, as part of the intro, there was some focus around key drivers for change. So beyond electronic patient records, EPRs, key drivers for new models of care include number 1, greater need for patient-focused services. Number 2, the need to embrace competitiveness and plurality of provision. Number 3, a requirement to reprofile the workforce to make it better suited to new technology and modern ways of working. Number 4, the need for the definition of core data to create a framework to measure efficiency and effectiveness. Number 5, recognition of the status of a core clinical service in relation to impact on the patient's journey, leading to a requirement for laboratory services to be commissioned and delivered as part of an integrated healthcare system. And then finally, number 6, the need for strong leadership. So then the second part of the poster presentation I'm going to highlight, it relates to some of the data that came out of particular works that were linked again with the renal patient support group, the RPSG. So in related to chronic kidney disease, CKD laboratory investigations and tests, basically the aims around this work was to explore the perspectives relating educational support surrounding chronic kidney disease, laboratory investigations and tests, and the scientist's role, really, from a sample of the renal patient support group, the RPSG. The research team conducted 5 main polls for 6 months, from January 2018 to July 2018, to help understand healthcare communication technology needs and importance of healthcare scientists, educational support, and laboratory tests and investigations. This work had 5 main objectives, or sub-objectives. So the objectives of the polls that were conducted were to help answer the following particular questions. Number 1, would you see a health professional other than your own physician? Number 2, how can health professionals better understand or appreciate being in a chronic illness? Number 3, healthcare scientists. Number 3, a question was related to healthcare scientists in primary care. Number 4 was a question relating to technology and usage, and number 5 was how likely are you to use the following future technologies for educational support? And in the poll there were sort of additional options, different things that different options that the RPSG membership could select from in relating to that particular question. So in poll one, for example, so I'm gonna highlight the data now, and then I am gonna highlight a little bit around the literature around this as well. But around the data. So poll one was, would you see a health professional other than your own physician? So in this, the choices where the patients or membership had in the RPSG to select from were yes, no, will only see my physician, and no preference. And of those who contributed into this poll, 61% said that they would see a health professional other than their own health health physician, other than their healthcare physician. Number two was, how can health professionals understand or appreciate being in a chronic illness? And in this, there were several options. There were several options that patients could actually select from. There was communicate. One of the things was communicate more with patients, learn through networks, more opportunities to ask questions, encourage them to learn through patient sort of support groups or patient networks, invite to kidney patient association meetings, give them time to understand, listen to patients more empathy, offer patient perspectives at lectures. And the highest scoring in this questions was basically where the membership at that time, at the time when this was being conducted, was that they wanted they said the poll data informed that to communicate more with patients was one of the most important findings. So there was communication was important. 33% said that communicating more would be important, and in relating to how can health professionals understand being in a chronic illness. And then in poll three, which related healthcare scientists' access in primary care and chronic kidney disease, the options were yes, no, and maybe. And it was about just under 80% said yes, that would be useful. Around 77%, and primarily the consensus, the preempt was, well, as part of this work, was to highlight that generally speaking, chronic kidney disease, or CKD, is primarily a biochemistry or laboratory medicine focused disease. So generally, the membership, the RPSG, the RPSG generally have questions quite routinely around different tests and investigations. So in a way, 77% where they said yes, and for example only 6% said maybe. Basically, the poll data at the time highlighted that healthcare scientists and having access to them in and around chronic kidney disease would be helpful. And then a lot of data was in relating to technology and usage. And some of the questions, some of the options in relating to this was, for example, a portal allowing access to medical records, online appointment booking and appointment-based systems, digital patient comms or communications, for example, email and text messaging, repeat prescriptions, remote patient consultations, online educational material, person-centered education, patient-reported outcomes relating to paper and digital methodologies, smart pill boxes, for example, digital medication reminders, and remote laboratory advice. And the highest that was polled in was was where patients or the RPSG membership wanted would find it more useful, where they had a portal allowing access to medical records. And generally, as I mentioned in a previous audio podcast, there is an existing electronic patient record that patients who have chronic kidney disease can have access, or do have access, pretty much anywhere. And so in part it wasn't surprising. So 26% said portal allowing access to medical records, and then second to that was online appointment booking or online based systems, online appointment based sort of systems. And then the final poll was relating to how likely are you to use the following future technologies for educational support from a healthcare scientist. So the options here were to communicate with a healthcare scientist, to receive text messages, to access a remote healthcare scientist, to access so there was to access remote healthcare scientists, and to access to access remote healthcare scientists in across three different ways. And basically, one would have been through online, one would have been through instant messaging, for example, and one would have been through videos, etc. And so the highest percentage at the time had been where the highest works, the highest modality of where the membership wanted access would have been through where it was 33%, 33% meant online, and then the lowest was one of the second to that was 26% to receive text messages as a reminder in one way to communicate. And also second to that was third was another way with a healthcare scientist involvement through another online modality as well. So in line with this, I'm now going to highlight a little bit around the literature around this. So over the past decade, the healthcare scientist profession has been advocating an expansion in the role of different healthcare professionals, in the role of different healthcare professionals, and from in so much from purely in some part in the literature where it had been highlighted, purely from a diagnostic role, from a diagnostic role to an advice educational focus, providing understanding of tests and results, and etc. Chronic kidney disease patients often seek education and understanding around these tests and investigations to support recommendations surrounding their disease pathway. Healthcare scientists have ability and capacity to extend sort of the knowledge base surrounding diagnostics to provide baseline education around the laboratory investigations for patients with long-term conditions. So healthcare scientists at the same time have a unique role to play. There is a broader evidence, broader volume of evidence to suggest that more health promotion in the community can support the understanding of some of the complexities relating to laboratory investigations, health and disease. In one particular study, in a mixed method triangulated research approach, 3 universities, academic institutions, 2 health departments, and 2 indigenous organizations collaborated to identify workforce capacity in remote communities through innovative education. And a need was found to educate the educators in the chronic care model and using a population health approach. So one of the challenges has been or is ensuring clear definitions of providers' roles and expectations regarding shared care. Defining roles and responsibilities will enhance the positive elements of misunderstandings regarding protocols, procedures, responsibilities, and authority. So I'm going to just highlight, so I've read out some of the data, the poll data that came out of this research, but just to highlight some in some context around the methodology around this as well. Previous studies. So what I mean. So what I'm saying. There's in related to the methodology. There's a justification for why the polls have been implemented in the first place. So previous studies have used surveys of polls of chronic kidney disease patients and the general public, and these studies in the poster presentation. The works have the references. So the particular study had inspired the poll implementation through the Renal Patient Support Group, the RPSG, and it was decided between the research team and the admin team, the moderators for the Renal Patient Support Group, that 5 short polls over 6 months, from January 2018 to July 2018, would be conducted through the closed social media platform, the RPSG. So in relating to the ethics approach, so consideration for the need for ethics approval was made, and the Department of Health guidance was consulted. So there's a governance document which relates to the governance arrangements for research ethics committees. It's a document that was published in 2012, and so the ethics committee approval, having referred to the governance arrangements for research ethics committee in 2012, ethics committee approval was not required for this work. However, what did happen is that however, the GDPR, the General Data Protection Regulation 2018 legislation was followed, and so this work aimed to obtain initial perspective from a social media platform, and it was important to get representation from various ethnicities using the RPSG, or the Renal Patient Support Group, and the polls were pinned. So they were pinned as sort of announcements at the top of the social media platform at the time. And so I'm now going to talk a little bit about the polls development and implementation. Basically, an initial version of the polls was piloted, and amendments were made to questions phrasing. Potential respondents were informed of the understanding for the different polls, the anonymity of the responses, and their availability to withdraw withdraw from the polls at any time. So there was no obligation for any members of the RPSG at the time, Renal Patient Support Group, to contribute to any of the polls. They didn't have to. The time frame for the collection of responses to the polls was limited to 6 months only. It was 6 months only, and therefore at the time when this work was conducted, a sample or a target size calculation was not carried out. However, a sample size calculation wasn't carried out. So what I mean by that, there was no statistical analysis as to how many members should respond to the different polls in order for there to be a significant percentage in the findings. Instead, what took place was a target sample of responses was set, and so the target response, the target number of responses that was set was 1,000 responses. 1,000 responses was set. And again, the questions were again, would you see a health professional other than your own physician? Number two, how can health professionals better understand or appreciate being in a chronic illness? Number three, if you had access to a healthcare scientist in primary care or community, could you tell if you had access to a healthcare scientist in primary care or community who could tell you all about your renal test and investigation, would you access the service? Number four, technology support and usage. Number five, how likely are you to use the following future technologies for educational support from a scientist? Now I am going to talk. I am going to give you. I've read out some of the poll data, but I am going to give more specific, more specific understanding context in relating to the results around the different polls that have been conducted. So out of the 1,000, the target sample, of 1,000 responses, 574 RPSG members participated in completing the polls, representing about just under a 10% response rate. It was about 7% response rate. Now, the respondents informed that they would see a health professional other than a physician as over around 50%, and that was so that was data related to poll 1. When asked about health professionals, when asked how health professionals could better understand or appreciate being in a chronic illness, again, communication was one of the most important, and 33% polled in on that particular option, also in that particular option. And then when chronic kidney disease patients were asked if they had access to healthcare scientists in primary care, would they access this service, the respondents polled yes, and at 77%, as mentioned. And then another response was a portal allowing access to medical records and laboratory results as the highest, and it was 26% who polled in on that particular option. And then when asked, that was in poll 4, and in poll 5, when asked how likely are you to use the following future technologies for educational support from a scientist, the respondents polled high on access to a remote healthcare scientist via computer or a desktop app, so you can access at home, and it was about 33% who polled in on that at the time. And then so now I'm just going to talk. I'm just going to highlight a little bit in relating to putting putting technology to the test, and then applications to practice and some conclusions. So, putting technology to the test, evidence indicates a large proportion of CKD patients access online health records intermittently, but over extended periods. The patterns and timing of use indicate strong patient interest in detailed information such as recent test results and clinical letters. However, this does not immediately mean that patients know what the results mean. Thus, health literacy is still an issue. And patients with long-term conditions seek more background and understanding relating to health and well-being to take ownership of disease. They also tend to do this faster than some of the very health professionals who look after them, and through online means and otherwise. Telehealth links for video consultations, imaging, and laboratory data could also help enable, for example, scientists to be involved in discussions with patients and carers remotely, and remotely through multidisciplinary team meetings. This would be advantageous given the population is generally living longer. So some applications to practice. Education healthcare professionals about the importance of the role of the patient and how to engage with patients is another key area of investigation. Evidence indicates that health professionals using medical jargon without patient having knowledge in the first instance will continue to act as barriers to communicate. And what should happen over time are more patient-centered consultations where patients have a good understanding of laboratory tests and investigations owing to the length of time in chronic kidney disease. Thus, targeting the attitudes and behavior of providers through potential solutions is important so that the relationship between the patient and the provider is balanced and smarter. The polls conducted have added value to an important topic, encasing scientists' involvement in provision of education surrounding laboratory investigations and tests for patients with chronic kidney disease. Greater use of skill mix will be key if the United Kingdom healthcare is to offer chronic kidney disease patients choice. The aim should be to equip patients with education and knowledge base to ensure they have a strong basis for shared decision making at all levels of their care. Scientists who have trained to acquire variable skills across practice and across specialties could perhaps apply education base to support patients with chronic kidney disease in primary care, and this will bring a much needed healthcare professional asset into primary care. More technology integration could allow for this. However, online digital scientists or e-clinics with a healthcare scientist could be another progressive proposition where a healthcare scientist could be involved online with patients, providing basic understanding of tests to prompt shared decision making. So the overall conclusions around this work were thus: chronic kidney disease patients see several members of the multidisciplinary team at varying times and can receive misinterpreted information. Whilst information technology and the exchange of laboratory results through electronic patient records has the ability for health professionals and patients to share care, there are still missed opportunities in primary care for the chronic kidney disease population. Chronic kidney disease patients still require access to education surrounding laboratory investigations, impact and result implications owing to issues surrounding health literacy. Healthcare scientists are at the forefront on the very basis of chronic kidney disease investigations surrounding the whole pathway of this long-term condition. Prospectively, healthcare scientists in the United Kingdom and nationally could be playing a broader role supporting educational care for chronic kidney disease patients, providing smarter care to support best practice. Overall, telehealth. So one of the main things out of this was that telehealth links for video consultations, imaging, and laboratory data could enable scientists to be involved in discussions with patients remotely through multidisciplinary teams. So on reflection in relating to social media in healthcare, at least over the last if over the last 5 years, if not over the last decade, generally social media has that ability, and through for example through collaborators like the Renal Patient Support Group and the Kidney Disease and Renal Support Group, or KDARS for Kids, there have been efforts where, for example, members of the group would for example post videos within the group. However, what happens then is that the videos or the digital content around a patient or a carer within the group itself, generally what would happen, it had been a case where the content was not anonymized. There had to be anonymity to the patients or the carers when and if they were posting their content. And so from an admin and moderating point of view, generally what happened is that the RPSG admin had an effort where a lot of the videos and content generally on the RPSG, on the Renal Patient Support Group, more specifically the RPSG, were placed in particular confidential folders within the group, so that patients and carers, etc., they would remain anonymous within the closed social media platform. That being said, on social media platforms that are linked to the main closed Facebook social media platform, there are five other social media platforms wherein patients and carers can interact, including YouTube, and Instagram, and within those social media platforms, the digital content to support patients and carers, for example, are available on there. And having said that, again, in relating to the reflections on the use of social media, generally, the RPSG has an admin and a moderating team that's of international premise, and so therefore as the RPSG has developed over a decade, generally speaking, the admins and the moderators also have their own efforts as individuals, and so from a collaborative sort of basis, and providing this data, this overview of this data of work that was presented, this work that was presented at the British Society of Lifestyle Medicine. It shows that apart from healthcare scientists' involvement, health professionals generally should be made available through social media platforms, and that part of healthcare, is still required. And so overall, between 2017 and 2021, in conducting part of this research, where this works had been peer reviewed, and published in a medical journal, was published in 2020. The data around this was published in 2020, and 2 years on in 2022, follow-up works have been put forward in relating to this work, and not so much poll data, but more to do with actually asking particular health professionals and patients around different aspects around chronic kidney disease care, and that works has recently been put forward for peer review, and so again, the works around the renal patient support group, the RPSG, have in some context standard test of the most trialing times in relating to supporting patients and carers, and again, without sort of the main health professionals that should be more involved, and so again, I wanted to provide this overview, since as a general reflection, there are the full works will be available through the renal patient support group, the RPSG, in due time. However, involvement around aspects relating to healthcare and research have actually stemmed back at least from the RPSG, the renal patient support group, before 2014, and so health professionals, again, whilst they may be available, whilst they are on the RPSG, we know that health professionals are not formally contributing to patient care in that way, and it's a missed opportunity, and so generally speaking, the involvement aspects have carried on since not just since 2014, but also before 2014, since the conception of the renal patient support group in 2009. So I want to leave this audio podcast on that basis. I want to say thank you to anyone taking a listen. This is available. This audio podcast is available through the Storm Robotics, through the Storm Robotics audio and audio channels. For example, the Instagram channel, and also on the YouTube Storm Robotics YouTube channel. So thank you for listening. This has been the Shientist. It's an audio podcast around the Storm Robotics case review v.2 on reflections on social media in healthcare 2017 to 2021. And this has been another Storm Robotics production. Thank you for taking the time.